So what are the signs that a person or their partner may experience if they have OSA?
I guess the first thing people notice is snoring is the most obvious initial sign. Initial people might snore just when they're lying on their back or if they've had some alcohol, but as it becomes more serious, people will snore when they're on the side, so pushing them over onto the side no longer works. And if that starts to be the case and their snoring is loud, then there's almost certainly some sleep apnea involved. The ultimate sign, of course, is if people then notice that they're taking a gasp. A sort of gasping. Notice if that's happening, they've definitely got sleep apnea. But just very loud snoring can usually mean that they've got sleep apnea. Other signs are going to be excessive daytime sleepiness. If you start to be falling asleep watching TV in the afternoons or in the evenings, or nodding off when you're on a flight or sitting quietly, those are sort of signs that when you feel that you're sleeping inappropriately, in other words, when you wouldn't expect to be able to fall asleep, which you weren't doing when you were 20 or 21, now you're falling asleep. It's not, something's happened that's made you more sleepy. The last one, I guess, is more for medical people, that if they're starting to notice that you've got developing hypertension, putting on weight, getting some early signs of diabetes, all of those should be red flags to a doctor. Just think, do you snore? Are you snoring? Is there a possibility you might have some sleep apnea?
Can we fairly well depend that the medical profession know enough about sleep apnea these days that they'll pick up those signs?
It's interesting because if you talk to most GPs, they'll know what sleep apnea is and they'll be aware of it, but it's so often not on their, what they call not on their radar, that they actually don't think. So in fact, it's really important, if you think you might have some of these symptoms, to mention it to your doctor, because they won't necessarily immediately think of asking. They'll do lots of blood tests and lots of examinations, but they won't ask if you snore. Some of them do, increasingly they do, which is great, but if they're not mentioning and you have some thought that your partner may have sleep apnea, then it's worth bringing it up to the doctor.
The snoring one's interesting because I believe that the actual patient may not be aware of their snoring or their apneas, just have the daytime drowsiness. So
absolutely, if they're by themselves particularly, it's difficult. The other side is that, of course, if a person starts snoring, then the bed partner often decamps to another room, and so they're not aware of the snoring or stopping breathing. And the difficulty, of course, is if somebody is by themselves, and then it's very difficult knowing what's going on. If there's any suspicion, nowadays cell phones and computers can record these sort of things, so it's maybe worth setting that up.
Right, so the technology can really help.
Absolutely, yeah.
So I guess the number one is that daytime sleepiness as the red flag to the person.
Yes. And the problem is that, of course, people, for example, who do work shift work, often will put it down to that. Or they're now not doing any exercise because they've got a young family and they're working hard and they work long hours. So there are lots of excuses why people do feel tired. And they often put it down to, I'm tired because I'm working so hard or because I've got a young family. But in the end, correcting for that, assuming you don't have those things, then tiredness can be a red flag.
And what are the risks for people if they go with their OSA untreated for periods of time? Is it important to get prompt treatment? And there are always three main things I look at with sleep apnea.
The first one is partner disturbance. So the first initial risk, I guess, is that you're going to lose your partner to another room. And that's the most common reason why people come and see people, us sleep doctors, is because they're needing to have to sleep now in separate rooms. So that's a minor problem, but it could become a major problem if left untreated. The second problem is daytime tiredness. And of course that can result in all sorts of accidents, particularly road accidents, very commonly associated with daytime sleepiness. And it's often not actually falling asleep at the wheel, but just inattention. So these micro sleeps become longer and longer, so that eventually people are losing concentration while they're driving. So that's another major danger. But the one that doctors will most commonly talk about, of course, are what we call cardiometabolic risks. Hypertension, diabetes, heart attack, strokes. Almost any part of the body can be affected by sleep apnea. Reflux, but much more common. Getting up to the toilet at night may not be for men, may not be prostate. It's quite likely to be sleep apnea, for example. Depression. People are getting very tired and so they don't cope so well, so they get depressed. There's recent studies showing that chronic chronic kidney disease can be associated with sleep apnea. Even gout has recently been associated with sleep apnea. So you name almost any part of the body system. And because the sleep is such an important part that we're not doing well if we have sleep apnea, then it impacts on all parts of your body, whether it's psychological or physical. It's going to impact on that because you're not sleeping well, basically.
So is it just the sleep deprivation, or is it the reduced oxygen levels?
It's a bit of both. Sleep is undoubtedly fragmented, so you keep on knocking yourself out of these normal nice sleep cycles into a very light level of sleep. But there's a lot of evidence to say that the lower the oxygen levels go at night, the more serious is likely to be the fatigue, the sleepiness, for example. So it is both a lack of oxygen that occurs. But for example, children who have sleep apnea often don't desaturate very much. And I should say at this point that 3% of children, up to 3% of children have sleep apnea. And that has a huge impact on their growth and their cognition and their learning abilities. And they don't seem to desaturate very much, but they still lose concentration and they don't function well during the day. And often can be diagnosed with ADHD, of course, because they're not concentrating and their behaviour's not controlled, so they lose get this impulse control disorder.
Mm-hmm. So really important because I think probably a lot of people are unaware of the fact that children can suffer. Tends to think that it's an old people's problem. Right. It's not these days.
No, so if your child snores regularly, that's not normal. Children should not be snoring. And the nice thing about children is that most of the time, adenotonsillectomy is curative. You take your tonsils and adenoids and it's gone, which doesn't often happen in adults, unfortunately.
Mm. So it's not a problem with an easy cure for adults?
Not an easy cure usually for adults. In fact, curing is not a word we commonly use in adults. It's more controlling of it than curing it. If you turn out to have very mild sleep apnea and you've still retained big tonsils, yes, a tonsillectomy will be helpful, but there are very few surgical options that are actually shown to be very effective.
What about changes in weight? Is that a factor? Can that actually reduce the problem?
Yeah, yes, undoubtedly. Weight reduction does make a huge difference. The problem with losing weight is that it becomes incredibly difficult for people with sleep apnea, and it's to do with fatigue. Fatigue has two major problems. First one is that you lose motivation to exercise. So if you're very tired, you come home from work, you're tired. The idea of going for the gym, going for a workout is really tough. The second problem is that it all alters hormones in your brain called leptin and ghrelin. Leptin levels drop, ghrelin levels rise, and that makes you feel hungry. So you might say, well, I know I've got plenty on board, but my brain is saying I really need to eat something. And unfortunately, we don't snack on lettuce leaves and celery and carrots.
So really important to get the treatment and then maybe focus on the diet once you've got things under control.
Absolutely.
Right. So now if somebody suspects that they do have OSA, what are the steps that they should take to get diagnosis and treatment?
Well, I think the first thing is wherever you are in the country, you need to talk to your doctor about it, because although they may not have asked you about it, they will have some idea about how you can go about getting this sorted out. Most DHBs have a facility for investigating sleep apnea. Sadly, because it's becoming such a prevalent problem, or becoming recognised so much more commonly, most DHBs have quite a long waiting list. But that's undoubtedly the first protocol, is contact your GP, see what facility you've got in your particular area, and go through the hospital system. Now, because there's such a flood of people, the hospitals really only look at the most severe sleep apnea, and in some areas it is very severe sleep apnea before they even look at you. So if you think that you've got some sleep apnea, that you've been turned down by the hospital, for example, that they're not going to see you, doesn't mean to say you don't have a problem. And so you need to be looking at other options, and there are a number of private options which are a little bit expensive, some more than others, but would get you treatment very much more quickly. So if you don't meet the criteria for hospital surveillance and investigation, but you're eligible for a disability allowance, it can be put on, WINS will pay for the investigation and for the treatment as well. So it is an option for those who aren't quite severe enough but still have significant symptoms from sleep apnea.
So in that instance, do they seek the diagnosis first, or do they need to go to WINS?
I think the diagnosis needs to be made first, because that will find out whether you're in the category that's severe enough to be seen at the hospital. Because if you're severe enough to see in the hospital, even if it's a year's waiting list, WINS won't touch it.
Right.
But if you're in that category where you've got sleep apnea, but it's not bad enough to be seen at the hospital, which is very severe, I might say, in many DHBs, then they will look at helping out with that.
We do hear of people who know they need treatment, don't qualify for free provision of a CPAP machine. Is there any other form of funding that people can look to, or are there? And we also hear of people wanting to get second-hand machines, which
Yes.
of course can be problematic.
Yes. Okay. So that can be a problem, because if you get, and you can certainly buy them very cheaply over the internet, on eBay or Trade Me, and or indeed some people have their relative's CPAP machine that they're no longer using. The problem is that it needs to be set up correctly, and if you just get a second-hand one, it's much less likely that you're going to get the support you need to actually go on and use it correctly.
So the situation there is that this CPAP machine needs to be set at a pressure that is right for you as an individual, isn't it?
Yes.
So that's the part that needs to be attended to.
Yes, absolutely. Yes, there are many aspects to setting up CPAP, and one of them, of course, is the correct pressure. And although in some places they may not be immediately set at the correct pressure, they can work with the therapist to get it right. The other aspect, of course, the most important part, which is the interface between the machine and the person, which is the mask. And unless you've got a mask that fits comfortably, then you're not going to use it, or it's going to be very uncomfortable. So mask and the machine at the right pressure. And although most of the complications of wearing the mask, CPAP, are very minor and can easily be fixed, they can easily be overcome, then you need to be talking to a therapist to do that. Most commonly, that first 2 or 3 weeks is really crucial to actually get yourself comfortable with it. And so often people are left with a machine, maybe set at the right pressure, but they're not given the follow-up that they need to feel really comfortable with it, and they'll tend to say, can't be bothered with this.
That's one of the problems that we hear most when we have our support meetings.
Yes.
So if people are struggling with a mask and they've been to see somebody and they've said, well, you'll just have to live with it now, should they take that as gospel, or should they go back and say, no, sorry, I think we can do better?
These problems that most people have, mask fitting too much pressure, too humid, too dry, it's too tight, they've got it too hard on their face, they're all problems that can be easily fixed. And the therapist, your sleep therapy, wherever you are in the country, should be able to support that and tell you how you can manage that, because they're all manageable. They're minor problems in the whole scheme of things, but they need to be managed, otherwise you're not going to bother. If you went to get a pair of glasses, for example, you don't just buy some, they tend to fix it for you to get it so it fits correctly on your face and fits comfortably around your ears. Same sort of thing needs to be done. You can't just buy one off the shelf and expect it to immediately fit.
So if necessary, be persistent.
Be persistent, absolutely. And there are many types of masks. For example, most people manage with just a nasal mask, just over your nose. But you may possibly need a full face mask if you have a mouth leak. And if that doesn't work, then often these nasal pillows, they just fit under your nostrils and go over the top, and that's also very convenient for some people.
We've got quite a bit of information about that on our website, so hopefully people will follow up on that if they need more information. What advice do you usually give to someone just starting out on treatment so that they do have a smooth run-in with it?
The time when this does become a bit of a problem is, say, with young people, particularly early 20s, who are unmarried and are very embarrassed about the concept of going around to their first date with a little machine saying, excuse me while I put my mask on. However, more embarrassing than that is that, in fact, often they don't go to stay with people because they're worried about the noise and they know they're snorers. I get a number of people who, for example, are keen trampers, for example, and they stop tramping because they're too embarrassed because they make too much noise.
Today you can get very small devices, can't you, which can actually help in those situations.
Yeah, so there is a machine called a Transcend, which is a really small. It's about the size of a can of Coke, and it has a 3-day battery, for example, that you can use. So that can easily be used in a pack and taken with you on tramps. In fact, we've got a young man who's on Mount Everest, base camp Mount Everest, demonstrating his Transcend machine. So they are very useful, and there are going to be more of them. The downside to Transcends are they're a little bit more noisy. So they're commonly not used as the primary machine. The primary machine is usually much quieter. But in terms of packing and carrying them, that's a good idea. But there are other options as well that people can use, and we'll perhaps discuss that in a minute in terms of mouth guards as well.
People can also look on the website. We've got information about some of those appliances, so
good.
further work can be done. So what are the common problems that people experience, apart from the ones we've already mentioned? There are some that, mask leaks, those sorts of things.
Yes.
What are the problems?
The most common one, I guess, one of the most common ones is just pressure on the face. So people are trying to tighten it too much. That's a common one. Nasal irritation, so they either get a runny nose or they get a very dry nose, and again they can be easily managed. Mouth leaking, so your mouth drops open and you leak. I might say that most people who are mouth breathers during the day do cope very well with just a nasal mask. It seems that the tongue rides up and it stops air coming out of the mouth at night. So most people, even if they're mouth breathers, will cope with a nasal mask. But sometimes they do continue to leak during the night, so that's not so easy. Tossing and turning in the night, most people, of course, with sleep apnea are very active sleepers because they keep, in effect, strangling themselves during the night. So they are tossing and turning, and people worry that I can't move around with it. But the reality is you can actually move around reasonably well with it, and you can lie on your tummy, on your side, on your back, and it will move around with you. But again, the therapist is the person who will talk you through all the little nuances of how to get it comfortable.
Yes. I believe you can also put the hose so that it actually goes back behind your head and fix it somewhere on the headboard or something.
Often people have a little piece over the back so you can loop it over that. Often we suggest it should go under the duvet so that it actually slightly warms the air. But nowadays, a number of the companies have actually solved that problem of the air getting too cold as it comes up to the nose. So most of the companies have solved that one.
I know that for myself that my partner often suffered with the cold air with certain types of masks, and so again that's something else you can pursue and check out the website because there's information there about that.
I think one of the major downsides actually to CPAP is ensuring that the partner is on board with this. Because if you have a partner who's averse to you even thinking about sleeping somebody with a mask on their nose, it's going to be really difficult for that person to put up with it. So if you can, go in to see the doctor with your partner so they can explain to both parties what's actually going on and the importance of using the mask. Then that will you'll solve quite a lot of problems.
Yes, I think once people understand that this can lead to life-threatening problems if you don't, if you're not compliant with your treatment, it certainly takes away a lot of those. And as you say, putting the mask on after you've, all activities have ceased and you're ready for sleep, that's the time to put the mask on. Absolutely. And that solves a lot of those problems.
Yes.
Great. Okay, so let's assume now that we've got all the problems sorted, everything's going fine, but we get to the stage where parts start to wear out on the machine. What do we do then, and do they need to be checked regularly?
Well, the machines themselves are extremely durable, so actually the companies usually give at least a 2 or 3 year warranty on it, even up to a 5-year warranty on their machines. So the machine itself is pretty robust. So the things that will need changing or altering every 6 months or a year will be the mask. The soft part and the front part of the mask can wear out. Fortunately, many masks now are in modules, so you don't have to replace the whole thing. You can replace just part of it. The straps around your head will get a little bit worn, so they may need changing. And the filter. Filters are very cheap, and they may need changing every 3 to 6 months or so, depending on whereabouts you have it in your bedroom. So if you do need replacement parts, then you need to go back to the therapist who actually initially put you on. So if it's through a hospital board, you need to go through the hospital DHB. be, and just contact them and say what you need, and they'll usually have them pretty available. If it's private, again, you just go to the private service, and they will have them the parts available most of the time.
Because OSA is becoming so common, a lot of the DHBs are struggling, aren't they, to sort of keep up with supplying all these pieces. So it may be that in the end you have to buy some of the consumables yourself or not.
Yes, and the DHBs vary. Some are happy to hand out these consumables or these bits that wear out for free, but a number now aren't, and you will need to pay for these the spare parts. But as I say, they're pretty durable and they're not that expensive. Particularly the filters, which are the most common thing that needs replacing, are a matter of a few dollars each.
Right.
So it's you need to look after the mask, which mask care is really important, and the therapist again will give you an idea how to clean it and keep it relatively pristine. And if you're not forcing it onto your nose, then the rubber part's going to last much longer anyway. And try and avoid the dog or the cat getting hold of it.
And also, I guess, be careful what cleaners you use. They often say whatever you would use on your face is okay for your mask, but if you wouldn't use it on your face, don't use it on your mask.
That's a very good tip, yes, absolutely.
What about people going overseas or who like camping or motorhoming and so on? What are the options there?
Most of the machines run off 240 volts, of course, which is okay in most European countries. But if you go to the States, for example, they usually automatically change to 110 volts, so they will change their setting. And the bags that they come in are really quite small these days, so you can transport them very easily. And to be honest, most people who get onto CPAP and are comfortable with using it will want to take it everywhere. Partly because 1 or 2 nights without it and you're going to go back to where you were before in terms of your tiredness, which people usually don't like. So taking it with you is very important. Most airlines now, if you're travelling overnight, most airlines now will accommodate you using the CPAP machine. So they'll put you in a place where you can plug it in and use it. And they would rather you use your CPAP machine than snore and keep everybody awake. So most airlines are quite happy for you to use it on overnight flights, for example.
Is it still a problem when you're in an upright seat, or is it tend to be more when you're lying
when
back?
When you're in an upright seat, of course, you will snore less. Snoring is always worse when horizontal, and the more you lift your head or your whole body, the less snoring you're going to do anyway. But of course it can be used sitting up, as you might have done when you first got the machine and you practice with it and sitting in front of the telly. It works anyway, it keeps the airway open basically, so you can use it. But of course it's even more important to use it overnight if you're going to be lying relatively flat.
So contact the airlines.
Contact the airlines.
They need to check out some machines, don't they?
Sometimes you need to fill in a form basically, and the therapist group should have those forms available for travelling overseas, and they will need to fill in a form which is a medical device in some respects, so they need to know what you're taking. Many years ago, of course, when you went through customs with one of these things, people would wonder what on earth it was and be very nervous about it being a bomb of some sort, but these days, there are so many around these days that they're pretty familiar with most of the machines.
Good. If they've tried everything and they're still not having much success with CPAP, what do you recommend? Are there other treatment options?
Yes, I mean, in the end, about 10% of people do struggle significantly with it. If they're taken through the proper setting up process, most people actually can tolerate CPAP very easily. But it takes practice and it takes patience and it takes you working with the therapist to do that. You're quite right, there are some people who really find it almost impossible. And to be honest, they're usually people who have a slightly more mild form of sleep apnea. But in those options, the other options are really mandibular advancement splints, which for the more mild sleep apnea will work, and that just keeps the jaw forward, so it keeps the tongue out of the way, and therefore opens up the airway. They're not sufficient for moderate to severe sleep apnea. The mask is really the only thing that will control that. But if you can't wear a mask and you've got severe sleep apnea, then using a mouthguard will actually help. There's a thing called a tongue stabilizer as well, which just fits onto the front of your tongue to keep the tongue forward. Again, it deals with the mild, just snoring or mild sleep apnea. It's more difficult to wear, but it works because if you can keep it in, because it keeps the tongue forward. For children, again, there are some other options. There's rapid maxillary expansion. Dentists will actually put a device in the upper part of your hard palate here to just open up the back of the pharynx. But we do use CPAP on children as well if it's necessary.
And I guess the important thing is don't give up too easily.
No. If you've got sleep apnea and it's been diagnosed, then working pretty hard to actually, it's really worth getting rid of that for a number of reasons. I mean, as I say, the main ones are tiredness, partner disturbance, and that cardiometabolic risk is huge. In the long term, even medium term, that can be quite significant, quite dangerous, in fact, in some cases.
And sometimes the answer is daytime practice, sitting up in a chair.
Absolutely.
Where those who suffer a little bit with claustrophobia don't need to feel that they're going to miss out on their night's sleep.
No, that's exactly right. Practicing with it, sitting in front of the television with some distraction, for example, just holding the mask in front of you and getting used to the idea of something on your nose. It really is worth desensitizing, if you like, this idea that you get claustrophobic. A lot of people say they don't like something on their nose, but they wear glasses, for example, so presumably they got used to with something on their face. This is a little bit more enclosing, I guess, but it's pretty minor. And these days, as I say, just a nasal mask is what most people cope with anyway.
And I guess, do people tend to over-breathe with it when they first start with it? Is that
the
problem?
They get panicky, that's the problem. And again, that's what the therapist will talk you through. But the main thing is, if you could consider it as being a fan in a box, it's a little aerated fan in a box, and so it's not a horrific, blasting the air out of your back of your throat. Most of the time, when you just breathe out, just breathing out like that, you're breathing out at about 25 to 30 centimetres of water pressure. The pressure going in is much more likely to be something like 10 or 12 centimetres of water. So you've actually got plenty of leeway to breathe out. If you can control your mind to say, this is okay, I can do this. And your lungs then very quickly accommodate that. So that after a few minutes, when you're used to it, the lungs immediately say, oh yes, I've got the new pressure, and that you carry on breathing as if you had nothing on your nose. So it is practice, it's perseverance, and connection again with a therapist.
So often overcoming those fears are really important.
Yeah, absolutely.
And then there's one, as I told one person once, eventually it's just harden up and get on with it.
Yes.
And she actually thanked me for it a few days later. She rang up and said, I tried it. And I'm like, after you said that, I thought, I'll have to do that. And, and she reported that she actually
And when you look at the potential side effects from it, it is really worth persevering quite severely to try and get rid of it.
Well, thank you for that, Alex. It's been really good to have that information for people. And, of course, there's more information on the website that people can follow up with later.
Excellent. And so a great organisation, so please do contact the Sleep Apnea Association in New Zealand, so SANS. They've got some excellent information, as Jill has mentioned.
Thank you.
Thanks.